Hello, my name is Wes Youssef. I'm representing St. Markorius Pharmacy Delivery System. We are a family-owned business since 1959. Started in Egypt with a small chain of retail and compounding pharmacies. Then the family moved to the States back in 1996. I'm a registered pharmacist in both countries. Received my pharmacy education at University of Craiova, Romania, Alexandria University School of Pharmacy in Egypt, and I also got my license as a pharmacist in the States through the National Association of Boards of Pharmacies. I speak 3 languages: English, Romanian, and Arabic. I have operated my family-owned pharmacies for 15 years, worked for CVS retail pharmacy chain for 8 years, and Henry Ford Hospitals in West Bloomfield, Michigan for 5 years. I'm also working on getting my certification on MTM, Medication Therapy Management, and working on getting my MBA in Healthcare Management, and I'm halfway through. I'm also part of Henry Ford Health System Diversity Council. I'm familiar with the Middle Eastern, Eastern European, and American culture. My lifelong career is focused on patient care, patient safety, minimizing medication dispensing error, medication therapy management, as well as community public health education. My project today is a new pharmacy delivery system that would reduce cost and improve quality. This pharmacy delivery system is for retail and hospital pharmacies. 3 components in this project would include automation, delivery, and patient education. The healthcare system between safety and quality and cost. The cost of healthcare is arising. Improving quality and reducing the cost is the goal. Cost and availability of funds affect quality of healthcare. More cost-effective system is much needed for better quality and availability of healthcare services. The healthcare cost in the United States alone was $1 trillion back in 2010. 8% of those is the cost of medications. And that's not including the cost of medications related to readmissions to the hospital because of the medication-related issues and medication and dispensing errors. 80% of the cost in the United States is funded through private insurances. The rest is Medicaid for low-income people and Medicare for retired seniors. Unlike other countries who have national healthcare system. This quality pharmacy delivery system is much needed worldwide to minimize the dispensing time, improve accuracy and patient safety, minimizing dispensing errors, and to reduce cost, especially for those countries who have national health insurance funded through local government by taxpayers. For example, Canada, United States, and Australia. Those countries are immigration countries and they have modern, diversified society. You may find a region in Canada like Montreal with French as their first language, other areas within those countries with Spanish or Arabic as their first language. In order to reduce cost and get better quality, my project has 3 components: automation, delivery, and patient education. As you can see in this slide, it's showing how the pharmacy can be automated. And the first step in the pharmacy workflow is the data entry. where you feed in the system with the patient information, drug name, strength, and direction for use. And the system, as shown in this slide, would get the information, pick the right medication, and dispense it. In the meantime, the screen would show the pill image for quality assurance and also would print a label and place it on a selected size vial. As you can see here in this slide, the pill image is a very important component of quality assurance, and the label that's going on the vial showing this way with a barcode also for quality assurance, and it has all the patient information, drug information, and the direction for use. So the automation is 3 steps. Data entry, as I mentioned. The second part is the dispensing process, where the system will pick the right medication, count it, fill the right size bottle, and label it. Then the third step of the automated pharmacy system would be the verification by the pharmacist. The verification by the pharmacist always start by reviewing the patient chart. That's why it's very important the pharmacy software should be connected to the hospital software. The pharmacist would also review the patient profile for any drug-drug interaction, drug food, drug disease, or drug OTC interactions. After this first step of verification, the pharmacist would move to the second step of verification, which is making sure through the pill image what was dispensed is the right medication. After the second step of verification, the pharmacist would sign off this prescription, then packaging, then the prescription will go to will call to be sold at the point of sale or delivered. And we will talk more in brief about the delivery process. This simple chart would show you with the new model, the new automated pharmacy delivery system, how simple the process is, starting by data entry, dispensing, then delivery or selling at point of sale. So in this model, it takes about 140 seconds, which a little bit less than 3 minutes to get the prescription ready in an accurate way. And this is the new improved workflow. Another chart. And that would move me to the second component of my project, which is the delivery part. When we were talking about the delivery and the importance of the delivery, we can talk about retail delivery and hospital delivery system. In the retail pharmacy should set up a time to refill the patient medication, to make sure the medication is being filled on time and the patient is compliant and doesn't miss any of his or her doses. In the hospital, especially the discharge medication, the process is very critical. A 4-year study in Henry Ford Health System found that 35% of the patient readmissions within 30 days were medication related. When the patient gets readmitted to the hospital within 30 days for the same health issue will cost the hospital and the country's healthcare system millions and millions of dollars. Patients usually do not fill their discharge meds, or the discharge meds gets mixed up with the medication the patient already has at home, which leads to double up or sometimes patient miss doses going home. When the pharmacy is automated with all safety features, with drug utilization review, pill image, quality assurance, along with time and cost saving, the pharmacy will deliver the discharge medication to the patient's bedside, which is making sure the patient is going home with the correct discharged medication, making sure that the patient is not missing a dose going home, making sure the patient is being counseled at the bedside and understand the directions for use and avoid missing doses or mix up with the meds at home. This simple delivery process has reduced the readmission rate from 35% to 12% in just 3 months. The last component of my project is the patient education. Patient education is a critical component of my project because it's focused on medication therapy management and preventive therapy. We should have ongoing health education in the following areas. Educate our patients in the community in drug-drug interaction, drug-disease interaction, drug-OTC interaction, disease-specific education, for example, diabetes, Parkinson, cancer, AIDS, viral and bacterial infections, and the antibiotic use. General public health, and we should also focus on preventive therapy. Utilizing the three-component project will change the healthcare concept approach, improve the quality of healthcare, improve patient safety, reduce the mortality, and will reduce the overall healthcare cost. At the end, how we can make a good use of diversified culture. Understanding different diseases to different ethnic groups. Example, African Americans are more prone to diabetes and heart problems than other ethnic groups. Women are more prone to certain type of cancer than men. We should train the locals and use them to apply the new healthcare approach with the three component, and we should train them on patient education as well. The three component will reduce cost and improve quality. Through reduction in readmission rates to the hospitals, less operating costs and time, the pharmacist has more time to counsel patients, more accurate and less medication-related complications, preventing therapy and patient education along with a prescription for disease-specific education. In my personal opinion, we should receive not just a prescription for medications, but also a prescription for disease-specific education. And our locals should be trained to educate our patients about their own disease state and how to handle themselves, not just using medications, and also by improving their lifestyle and the quality of life. At the end, I will thank you for giving me the opportunity to present my project.